for the child development and the survival.
Every
Every
year,
year,
from
from
15th to 21st
21st
November,
November,
the
fix the
infant
infant
mortality
mortality
rate in
rate in
India,
India.
although
Although
the
the
infant
infant
mortality
mortality
rate in
rate in
India has
India has
dropped
dropped
considerably, it
considerably,
is
it is
still
still
high
high
when
when
compared to
compared
those
to
of the
those of the
developed
developed
nations.
nations.
Every
Every
year,
year,
around
around
2.6
2.6
million
million
babies
babies
die in the
die in the
first
first
20 days of
20 days
life.
of life.
It is
It
most
is
in the
most in the
first week,
first week,
and
and
additional
additional
2.6 million
2.6 million
stillbirth
stillbirths
occurs
occurs
each year.
each year.
The
The
goal of
goal is
reducing
reducing
under 5
under 5
mortality to
mortality to
20 or
20
less
or
than
less
per
than per
1000 live
1000
birth
live
by
birth by
2035
2035
can
can
only be
only be
attained with
attained with
specific
specific
efforts to
efforts
reduce
to
the
reduce the
newborn
newborn
mortality.
mortality.
Labor,
Labor,
birth,
birth,
and the
postnatal
period are the
period are the
most
most
critical for the
critical for the
newborn
newborn
and the
and the
maternal
maternal
survival.
survival.
And
And
75% of
75% of
newborn death
newborn
can
death
be
can be
prevented with
prevented
known
with known
effective health measures
effective
provided
health
at
measures
birth and
provided
during
at
the
birth
first week of
and
life.
during the first week of
The
life.
above mentioned
The
data
above
clearly
mentioned data
indicates
clearly
the
indicates
importance of
the
newborn
importance
care
of newborn
and
care
is
and is
self-explanatory. So for
self-explanatory.
any
So for
country to
any
progress,
country to
it is
progress,
very much
it is very
important
much
that its
important
young
that its
population
young
remains
population
healthy.
remains
So
healthy.
considering
So
the high
considering the
neonatal
high
mortality
neonatal
rate
mortality
and the
rate
infant
and the
mortality
infant
rate in
mortality rate
India,
in
it
India,
is
it is
imperative to raise
imperative
the
to raise the
awareness
awareness
about the
about the
importance of
importance
newborn
of
health.
newborn's health.
So today
So
we came
today
with
we
the
came with
theme
the theme
strategy to
strategy to
strengthen the
strengthen
newborn
the
care,
newborn care,
survive the
survive
healthy
the
future.
healthy future.
Thank you.
Thank you.
Thank you very much, madam. It was really a spectacular speech. It was pleasure listening to you. Thank you once again, madam. So we feel honored to have with us the Honorable Chief Guest, His Excellency Professor Dr. Prasant Kumar Sabot, Secretary Odisha State IAP. So you hardly need any introduction. You have made all of us proud for your distinguished work in numerous capacities. So has completed his MD Pediatrics, PG Diploma in Health and Family Welfare Management, PG Diploma in Psychological Counseling, and is a well-known pediatrician in Bhubaneswar. He is closely working with NHM for strengthening neonatal care in government facilities. He is also providing technical consultancy to various states on SNCU and NBSU operationalization and quality improvement. He is working as national faculty for NRP, NSSK, FPC, and pediatric emergency triaging and treatment in public facilities. He has trained more than 100 pediatricians across the country. He has participated in more than 30 national conferences as speaker and panelist. I take privilege to request our Honorable Chief Guest to address the delegates and motivate them by his words of wisdom. Over to you, sir.
Thank you, Dinbandhu, for your kind words and introduction. So, first of all, I would like to congratulate the organizer of this international webinar. So, I feel very proud that being from Odisha, that today, under the leadership of Dean Dr. Professor Prabhati Madam and her team, that we are organizing an international webinar. Though it is in Corona time, it is a blessing in disguise. Also, we can say that so many of our dignitaries and participants are in under one, umbrella and in one platform. We are able to meet people. So this is really a very big achievement for us. And newborn week celebration or observation is really a very good step and a positive step to motivate and mobilize all our students, faculties, doctors, pediatricians in to for a common goal of achieving the minimal neonatal mortality rate as we have planned in under INEP, Indian Newborn Action Plan. So this under newborn action plan, the government of India, government of Odisha, everybody has a dream that to bring the neonatal mortality rate for a single digit. So it is not an impossible task, Single newborn mortality is not an impossible task. If we are team up together, we can always achieve this. So this is high time that the madam is organizing this, and the backbone of newborn care is staff nurses. I am working for newborn care in public health for last 15 to 20 years continuous in India, and also I work in some of the countries in Africa and US. So what I found that everywhere, it is staff nurses, and staff nurses. Doctors, pediatrician, neonatologist, they take care of hardly 10% of the babies. 90% of the babies are saved by the great staff nurses and nursing officers. So I will like to request everybody to clap for us, for the staff nurses itself, that, this is a very, very big thing. I feel newborn week, this N is for newborn and N is for nurses. So, and I will tell you that our state is the first state in the country to have a nursing directorate. The nursing directorate, a special nursing directorate is there. So we see that the nursing professionals in our state are the best trained nurses. Though in critical care, we can say that very advanced things are not in our state. But if you see the basic nursings, if you see the emergency triaging, if you see the newborn care, if you see the quality circle, the knowledge on the quality circle, we are best. I visited Himachal Pradesh, each district. I have interacted with the faculty of staff nurses of Himachal Pradesh, Punjab, Haryana, Chhattisgarh, Uttarakhand and Jharkhand. And I find there's a hell and heaven difference. Our are more trained, more, they take better care. Understanding is good. Teamwork is excellent. And the responsibility which our staff nurses take, it is 100 times better than anybody else. So the newborn which are saved today, I give the credit, because all of us are aware that the deaths in newborn is only, the majority reason are three. One is sepsis, one is prematurity, and one is birth asphyxia. Other reasons are there. So to address the sepsis, now you go to and interact with any staff nurse, you will see that our nursing officers and nursing staff, they are having very trimmed nails. They are expert in hand washing. They are training the mothers in hand washing. They know all steps of hand washing. Without hand washing, they are into any NICU or SNCU or newborn care. They know personal sanitation, hygiene. They are teaching the mothers also about sanitation, hygiene, how to take care of the babies. So the death due to neonatal sepsis has really come down. Similarly, if you see the birth asphyxia, the resuscitation, quality and the resuscitation capability of staff nurses in the last 5 to 7 years has increased. Now our staff nurses are independently able to handle the resuscitation of a newborn. If they are in a team, they are able to do the resuscitation. The interest to learn resuscitation through NRP, the neonatal resuscitation program, and NSSK, Navjat Sishu Suraksha Karyakram, and other means. So they are expert now to do the resuscitation. So this birth asphyxia, we are training the staff nurses in labor room, staff nurses in SNCU or NICU, and in pediatric ward. So these resuscitation measures now are being very well handled by the staff nurses. In many places, I have seen the nursing officers giving even the surfactants. So that is really, and the quality, the number of quality care and quality counsel, these staff nurses are now also improving the quality care of prematurity. They are learning the tips how to take care of the premature and doable actions. So they are not confused. So they know now 1, 2, 3, 4, what are the doable action. They are practicing evidence-based neonatal care protocols. So they are able to address the resuscitation measures so that the death due to birth asphyxia has come down. Similarly, for prematurity, it is a really team efforts. It starts from antenatal. It starts from the giving steroid to antenatal mother for a premature labor to the care of the premature once the delivery has happened. So this care, and also care after discharge, that is the most important thing. The teaching the mother, handling the family, that how they will take care after discharge. That is a big challenge in our country. That a premature after discharge, you have saved the baby, but when the baby is discharged, the care at home practicing exclusive breastfeeding, kangaroo mother care, taking care of the baby so that baby is not infected. That is very, very important. So the staff nurses are doing all these things and they are taking care and follow up of the baby for ROP, follow up the baby for hearing screening. So these things are equally important to have a healthy nation and a healthy country. So if you ma'am will permit me, I will have 4 slides I just want to share. Madam, can we have time? Just 4 slides.
Yes, sir. Yes, sir. Yes, sir.
Yeah, thank you so much. So this just I was really excited to see that the interest of organizing this international webinar. So if you just go through, this is the latest Lancet series, global cause of childhood deaths. So if you can see in one side, you can see the neonatal death, which contribute to 57.9% of deaths. This is actually the global figure, and you can see the common causes same preterm. It is sepsis, and it is intrapartum related or birth asphyxia or related to respiratory symptoms and respiratory system. Here in Orissa, you see this is a figure of 2018 SRS data. You can see that 90% of deaths of under 5 children is due to infant mortality rate. So the death between 1 year and 5 year we are able to reduce. Okay. So the death of the children under 5, 90% are happening below 1 year. Out of that, 77% are happening below 1 month. So which was 70%, now it is 80% of death. If you see, it is happening within 1 month of the age. And out of that, 80% is happening within first 7 days of birth. And out of that, again, around 50% are happening on the day 1, that is around birth, in the labor room, maybe in the form of fresh, maybe because of premature sepsis, birth, whatever the cause, maybe congenital defect. So, and the interesting thing is that it is a doable that we can reduce to 50%. So this is a district-wise neonatal mortality rate. If you can see the data, this is a little 2012 annual health survey, because nowadays they have stopped the district-wise publishing district-wise data on neonatal mortality. So here you can see that we have some with as high as more than 40, 45 neonate, and we have at the same time districts with a neonatal mortality 57. So you can see that there is a lot of variation. Why Balangir is having the country's highest NMR in 2012? Now it has come down. Now it is no more. Now in Orissa has progressed a lot. So you can see that the data analysis is done so that we can take action, we can take strategies to control that. So the national target of the reducing neonatal mortality rate by 2025 is 16, and stillbirth rate we are ambitious. We want it to single digit. Similarly, under Sustainable Development Goals, our target is to reduce neonatal mortality rate to at least as low as 12 per 1,000 live births, and under 5 to 25. So the ambition is very high, but we need to work also accordingly as a team and not in silos. Like not one person can't control. So there should be a team effort by the today some is doing, some nursing college is doing. Similarly, there should be these efforts from the government, from the professional bodies of pediatrician, doctor, managers, policy makers. So everybody should have their say and their contribution. So, for example, for prematurity, we want help of our obstetrician, gynecologists, so that the antenatal steroid is immediately given in case of premature labor when the mother is in labor. Similarly, in antenatal time, the mother should be given proper ANC, so that the mother is strong enough and the pregnancy is without any event. So that is equally important. Similarly, kangaroo mother care is another intervention, and early initiation and exclusive breastfeeding, all of us know about that. And birth asphyxia, we know stillbirth attendance I was talking about. Emergency obstetric care is another big gap. We don't have, in many hospitals, we don't have emergency obstetric care. In the same ward, there is two beds, staff together to save the newborn's life. So thanks for the invitation. Thanks for giving me an opportunity to share my feelings. Thank you, Dr. Pravati Madam and the team. Thank you so much.
Thank you, sir, for joining with us, sharing your things. Okay, thank you, sir.
Thank you very much, sir, for sharing your insightful knowledge with us. We are really grateful to have you in today's momentous occasion. Dear participants, now our scientific session is going to start. I request all of you kindly mute your audio and disable your video. If you have any queries, you can put your questions or drop your message in our chat box. Ladies and gentlemen, on this momentous occasion, it is our proud privilege and fortune to welcome our first speaker of today's scientific session, Mistress Achala, officiating nursing superintendent, Kalavati Saran Children's Hospital, New Delhi. Madam has completed her MSc in pediatrics from RK College of Nursing, New Delhi. She has more than 26 years of professional experience, trained in BPNI's training course on infant and young child feeding, counseling, and played a key role in the establishment of Infant and Young Child Feeding Center in 2008 at KSCH Hospital, New Delhi. He has also established CNE cell at KSCH Hospital in 2016 and working as a coordinator. She was awarded with various awards like the National Florence Nightingale Award for the year 2019 by Honorable President of India. She was also awarded a certificate of outstanding services and contribution to improve neonatal care on World Prematurity Day by IFPB in 2014. She is working as faculty for National Collaborative for Facility-Based Newborn Care. We are all are really by your presence, madam, on this significant day. Over to you, madam.
Thank you so much. I'm just sharing my screen. My screen is visible. Hello.
Yes, madam. It's audible and slides are also visible.
Okay. Thank you so much. Good morning to everyone. First of all, I would like to thank Professor Dr. Pravati Tripathi ma'am from SUM Nursing College, and also I would like to thank Professor Dr. Prasant Kumar, Secretary Odisha State, and it is really my great privilege to be amongst this August gathering, and for giving me this opportunity to speak on why optimal IYCF on International Birth Practices on occasion of Newborn Week. So regarding optimal infant and young child feeding, optimal feeding means it defines exclusive breastfeeding from birth to 6 months of age and thereafter continued breastfeeding for 2 years or beyond with adequate, safe and proper additional foods and liquids to meet the nutritional needs of a young child. So there are few definitions for infant feeding. So exclusive breastfeeding, it means giving a baby no other food or drink, including water, in addition to the breastfeeding with the exception of syrup or drops of vitamins, minerals and medicines, and expressed breast milk is also permitted. And predominant breastfeeding means breastfeeding a baby, but also giving small amounts of water or water-based drinks. And in bottle feeding means feeding a baby from a bottle, whatever in the bottle, including expressed breast milk. But these things we are not recommending. And regarding the artificial feeding means feeding a baby on any kind of artificial milk, such as animal milk, tinned milk, etc., and not breastfeeding at all. And partial breastfeeding means giving a baby some breastfeeds and some artificial feeds, either milk or cereal or other foods. And regarding the timely complementary feeding means giving a baby additional food and liquids in addition to the breastfeeding when it is appropriate, that means from 6 months of age. So there are various advantages of breastfeeding. So advantages of the breast milk as well as the advantages of the breastfeeding. As it is a perfect nutrient means it provides complete nutrition to the infant up to the age of 6 months, and almost half of the nutritional requirements between 6 to 12 months, and up to one third between 12 and 24 months. And it is easily and as it is convenient and it is available for 24 hours, so mother can feed at any time. And it also protects against the infections as it is having many anti-infective properties, so it prevents several infections including diarrhea, pneumonia, and otitis media. And it also protects against adult onset of diseases like in later on in the life, like diabetes, hypertension, eczema, asthma, rheumatoid arthritis, and other allergic conditions later in the life. And there are many advantages of breastfeeding also, as it also helps in bonding and development, as the breastfeeding enhances the emotional bond between the child and the warmth, love, and affection, and adequate growth and development, IQ levels, and it also prevents the hypothermia. And there are various advantages of the breastfeeding to the mother and to the family and to the society. As the breastfeeding, it protects the mother's health in several ways, and it can benefit the whole family emotionally and economically. It also reduces the post delivery bleeding and anemia, and breastfeeding has protective effect against the breast and ovarian cancers, and it also lowers the risk. And exclusive breastfeeding, it has a contraceptive effect and it suppresses the ovulation and delays the return of fertility. And it also protects the obesity and shapes the body of a mother. As the mother, if she is exclusively breastfeeding, and she reduces the weight also, and she regains her normal figure, and it is convenient also. And the benefits the family enjoys, like breastfeeding, it is economical, and as it is a free of cost, and at any time mother can breastfeed the baby. And as the babies, those who are breastfed, they fall sick less, so there is a less illness, so there is a less financial burden to the family, and it promotes the family bonding. So there are various benefits to the society also, as it is eco-friendly, because artificial feeding leads to more deforestation, soil erosion, pollution of water, air, and soil. And the breastfeeding babies, they develop to be a better human resource and therefore improve the productivity and economy of a country. So economic development is also there. So now we can see the nutrients in the human and animal milks. If we'll compare the composition or the nutrients that they are present in the human milk and the animal milk, so here we can see what the difference is in these milks. So as we can look into the macronutrients in the breast milk to see why they are perfect for a baby, like human milk, what is the difference? So as we can see, all the milks, they contain the fat, which provides much of the energy that a young baby or uh, that a young baby needs. And they also contain the proteins for growth, and they also contain the special milk, which milk sugar, that is called the lactose, which also provides the energy. So here in this picture, what we can see, there is a difference of proteins present in the milk of human or animal milks. So as we know, the animals, they grow faster, so they require more of proteins for the growth. But the human beings, they that much of proteins, because the excessive, it is difficult for a baby's immature kidney to excrete the extra waste from the protein in the animal milks. And it is also seen that in the human milk, more of lactose is present than the animal milks. So, what is the difference in the quality of the proteins in different milks? So, here we can see, as we compare the human and cow's milk, what we can see that the most of the protein, they are in a form of caseins in the cow's milk, and they form the thick and indigestible curds in the baby's stomach. And there is less caseins in the human milk, that is only 35% of casein, and they form soft curds inside the baby's stomach and easily digestible. The soluble or whey proteins, they are also different from the the anti-infective proteins, they are present in the human milk, and it is not present in the cow's milk. It is in a form of alpha lactoalbumin in the humans and beta lactoglobulin in the cow's milk. And also it is seen that artificially fed babies, they may develop intolerance to the protein from the animal milk, and they may develop the diarrhea, abdominal pain, rashes and other symptoms. And sometimes the diarrhea may be so persistent that it can contribute to malnutrition. So the babies, those who are fed on the animal milk or the formula, they are mostly likely that the breastfed babies to develop allergies, which may cause eczema, and possibly all the allergies can happen. So with the breastfeeding, there is no allergic reactions. Babies having the animal feed or other milk, so the protein may cause allergies. So the anti-infective proteins that in the human milk, they also include lactoferrin and lysosomes, and as well as the antibodies, they are in a form of immunoglobulin, that is IgA. So here we can see the difference in the fats of different milks. As we know, in the breast milk, there is a fats are also present. So here we can see that in a human rated fatty acid, that is called the PS ratio. In the human milk, that is 1.3, and in cow's milk, it is 4. Lower the PS ratio means polysaturated to saturated ratio in human milk. It favors the calcium and fat absorption. So that's why the calcium and fat absorption is also better in the breastfeeding babies. And also it is seen that the feces of an artificially fed babies, they are different from those of a breastfed babies. This is partially because an artificially fed baby's stool contains more of the unused fats. Now, as the breast milk also contains various vitamins, and as we compare the humans with the cow's milk, so here we can see in the cow's milk, we can see there is more of vitamin B, which is present, that is not required. And vitamin C and vitamin A, they are less in the cow's milk. But as we can see in the human milk, there is vitamin C and vitamin A in an adequate amount. And vitamin A is near about 75 microgram per DL, whereas in the cow's milk it is only 41 microgram per DL, and vitamin C is in the breast milk it is 5 milligram per DL, and in the cow's milk it is 1 milligram per DL. That means 5 times the vitamin C is more and 2 times the vitamin A is more in the human milk. So, and it persists up to 2 years also. So no additional vitamin A is required if the baby is exclusively breastfeeding. So here we can see iron in the milk. As we can see, iron is also important to prevent the anemia, and different milk contains similar very small amount of iron, that is regarding 50 to 70 microgram per 100 ml. But the importance is regarding the absorption of iron. As in the cows or other animal milk, only 10% of the iron is absorbed by the baby. But in the human milk, the baby can absorb up to 50% of iron, so that the absorption of iron is good, and it also prevents the iron deficiency anemia in the baby. So here we can see the mechanism of protection against the infection. Here we can see as the baby's immune system is not fully developed and cannot fight infections as the older child, so the baby needs to be protected by his mother. Whenever the mother is infected, then the white cells in the mother's body, they make the antibodies to protect her, and some of the white cells go to her breast and make the antibodies there. And if the baby is suckling, and these antibodies, they are secreted in breast milk to protect the baby. So a baby should not be separated from his mother when she has an infection, because her breast milk protects him against the artificial feeds. They are the dead feeds, and they contain no living cells, antibodies, and few other anti-infective factors. So they provide protection against the infection. So if a mother is having any infection, then also the mother can feed the baby. So here we can see the composition of breast milk. What difference do you notice here? In this picture, you can see the colostrum, which is coming initially for the first few days, and after that, a mature milk is coming. So here we can see the colostrum is rich in more of the fats and proteins than the mature milk. And it is very, very important to give the colostrum to the baby, which is coming in the first few days of the delivery, and it is thick and yellowish or clear in color. And fore milk, it is bluish milk that is produced early in the feed, and hind milk is the whiter milk which is produced later in the feed. And this hind milk is more rich in more of the fats and other nutrients, but the fore milk is produced in the larger amounts, and it provides plenty of proteins, lactose, and other nutrients. And because a baby gets large amount of fore milk, he gets all the water that he needs from it, and so the fore milk is satisfied the thirst of the baby. And later on, the hind milk is coming, which is more rich in more of the fats and other nutrients. It will satisfy the hunger of the baby. So the baby required both fore milk and hind milk, so that the baby should have a complete meal. Here we can see some of the properties of a colostrum. As we see, the colostrum is rich in antibody, and so it protects against the infection and allergy. So it is a kind of first immunization against the diseases that a baby meets after the delivery. And colostrum helps to prevent the bacterial infections that are danger to the newborn babies. And colostrum is having many white cells, so it protects against the infections. And colostrum is also having a purgative effect, and it also clears the meconium, and meconium from the gut. That is the first rather dark stools, and this clears the bilirubin from the gut, and it helps to prevent the jaundice. And it is also having various growth factors which helps the intestine to mature and prevents the allergy and intolerance. And colostrum is also rich in vitamin A, and vitamin A also reduces the severity of infections. So it is really very important that a baby should get the colostrum initially. Here we can see the breastfeeding and cognitive development. As we have already mentioned that the babies, those who are breastfed, they are having higher IQ level than the others, those who have not breastfed. So it is seen that almost 6 to 8 IQ points, they are higher amongst the babies, those who are breastfed. And it is also seen that this ratio is more significant in low birth weight babies. And besides the general cognitive development, other advantages include visual maturation, language development, earlier motor skills, fewer emotional or behavioral problems, and less aggressive. These children also seen that they are less aggressive personality and fewer minor neurological problems. They are less seen amongst the babies. So it is very important. Breastfeeding is really very important. So we'll see the breastfeeding and low birth weight babies. It also prevents the hypothermia, hypoglycemia, and other metabolic derangements. And it also protects from sepsis and necrotizing enterocolitis, that is NEC, because it is having the immunoglobulins, erythropoietin, IL-10, EGF, and PAF acetyl hydrolysis, which reduces the risk of necrotizing enterocolitis. And it also optimizes the growth and development, and it reduces the mortality. The breastfeeding prevents early malnutrition also, and undernutrition and obesity also. So the faulty feeding practices leading to malnutrition, as we can see, it is a late initiation of breastfeeding and providing the prelactal feeds, not giving exclusive breastfeeding till 6 months, and late introduction of complementary feeding, and overfeeding in affluent society also. So here we can see the relative mortality risk in absence of breastfeeding. It is feeding is not given, then in less than 2 months, in, in less than 2 months, that we can see there is a risk of six-fold risk of mortality is present. And in 2 to 3 months, we can see fourfold mortality increase is present. And in 4 to 5 months, we can see 2.5-fold increase. The risk of mortality is present in absence of breastfeeding. So it is also seen that analysis also shows that breastfeeding in the first 6 months of life substantially protects against the deaths from diarrhea and ARI also. And two-thirds of infant deaths occur in first 2 months of life. So the breastfeeding is most protective during this period. Here we can see the under 5 child deaths saved with the preventive interventions. As we can see, the breast with the 13% of the lives can be saved with the breastfeeding preventive interventions, and 6% complementary more be saved by the timely introduction of complementary feeding. So this slide shows that universal exclusive breastfeeding for the first 6 months of life, it can prevent around 13% of under 5 child deaths, and appropriate complementary feeding can save additional 6% of young child mortality. Here we can see the percentage of neonatal death, say 2 to 28 days. Safe child is early initiation within 1 hour of birth. Then it is seen that the mortality is reduced by 22.3%. And if it is within 1 to 24 hours, means within 1 day, then also it can prevent 16.3% mortality. And if there is initiation after 1 day, it is associated with the 2.4-fold increase in the risk of death. And the risk of neonatal death is fourfold if milk-based fluids or solids they are given to breastfed neonates. So the advantages of appropriate complementary feeding, they are: it prevents the growth faltering and decreases the risk of nutritional deficiencies. It also lessens the risk of illness and it helps in proper development. It is also seen that breast milk in the second year of life also it is present. The vitamin A and vitamin C is present, and more of the needs of the energy and proteins are also met during the second year of life. So that's why it is said that exclusive breastfeeding for 6 months and it can be extended up to 2 years of life. Now we can see the dangers of artificial feeding and bottle feeding. So what are the dangers for the baby? Like the baby will have mood diarrhea, ARI and other infections. And as the artificial feeding, it requires preparation and it is not easy to digest and it lacks the balance of nutrients, and more likely the babies they are more likely to die from the infection and malnutrition. And it also interferes with the bonding and more the chances of more allergy and milk intolerance is also there. An increased risk of some chronic diseases is there if the baby is having the artificial feeding. And sometimes the excessive overweight or obesity can also occur and it lowers the score of IQ level for the mother, because the mother may also become pregnant sooner and increase the risk of anemia, osteoporosis, ovarian and breast cancers. So the recommendations are that we have to start breastfeeding within 1 hour of birth. We have to practice exclusive breastfeeding from birth to 6 months and introduce appropriate complementary feeding after 6 months of age, and sustain breastfeeding for 2 years and beyond. And we have to counsel the HIV positive mothers to choose infant feeding options most suitable to them and support their decision, and integrate infant and young child feeding with other health and nutrition services. This is they are the most important.
If you have any queries, we can
directly to the madam. The floor is open
that
to all of
directly
you.
to the madam. The floor is open to all of you.
So I guess there is no doubt
So I guess
from
there
the
is no doubt from the
participant side.
participant side.
Thank you very much, madam, for sharing your profound knowledge with
Thank
us
you very much,
on the
madam,
topic
for
of
sharing
optimum
profound knowledge with us
IYCF
on the topic of
practices.
optimum
The session
IYCF
was really full
practices.
of zeal and
The
valuable
session was
information.
really full of zeal and
Thank you very much.
valuable information. Thank you very much, madam.
Thank you, sir. Thank you so much.
ନା କଣ ଆମର କ୍ୱେଶ୍ଚିନ୍ ଟା କହିଲେ ଲେଖିକି ଦେଇଥିଲେ ତାକୁ ପଚାରି ହେଇନଥାନ୍ତା ଟାଇମ୍ ସ୍ପେଣ୍ଡ କରିବା ପାଇଁ କିଛି ନାହିଁ। ପିଲା ବି ପଳଉଛନ୍ତି ସବୁ ଯିବେନି ଏବେ ଏବେ କଣ କରିବି କଣ କରିବି ମୁଁ କହୁଛି ମୁଁ 5 ମିନିଟ୍ ମତେ ଟାଇମ୍ ଦିଅ ମୁଁ ଘରେ ଯାଇକି ପହଞ୍ଚିକି ଜଏନ୍ କରୁଛି। I request all the participants because you guys are really listening to the great speakers. I think you should have some doubt, but you are not at all sending any queries in the chat box. So I don't know whether you guys are listening or not. If you are listening, kindly send your doubts before now.
If you are listening, kindly send
So
your
our
doubts
next
before
speaker
now.
will be joining with us
So our
within
next
5 minutes.
speaker will be joining
I
with us
request
within
all of
5
you to
minutes.
be
I
there
request
online,
all of you
and
to
we'll
be
be
there online,
starting
and
the
we'll be
session
uh,
once again within 5 minutes.
starting the in 5 minutes.
ଏଇଭଳିଆ ସବୁ ପିଲା ଗୋଟେ ଗୋଟେ
ଏଇଭଳିଆ ସବୁ ପିଲା ଗୋଟେ
ଆମର
ଗୋଟେ
ସେଠି ଗପୁଛ କଣ ଏଠି
ତ
କ୍ଲିୟର
କଣ
ହଉନି
ହଉଛି ମୁଁ
କଥା
ବୁଝିପାରୁନି।
ଏଟା କଣ ହଉଛି ମୁଁ ବୁଝିପାରୁନି।
ପୁରା ବନ୍ଦ ଶେଷ
ପୁରା ବନ୍ଦ ସେସନ।
ଜଏନ୍ କରୁନାହାନ୍ତି।
ଏ ଯୋଉ ଆଉ ନେକ୍ସଟ ସ୍ପିକର ଜଏନ୍ କରୁନାହାନ୍ତି।
ଗୋଟେ କୋଶ୍ଚିନ୍ ଟା ବି ଲେଖିକି ଦେଲେ ମୁଁ କଣ
ଗୋଟେ କୋଶ୍ଚିନ୍ ଟେ ବି ଲେଖିକି ଦେଲେ ମୁଁ କଣ ପଚାରିଦେବି ସେଗୁଡା ଏବେ କିଛି
ନା
ନାହିଁ।
ଗୋଟେ ଟାଇମ ସ୍ପେଣ୍ଡ
ନା
କରିବା ପାଇଁ
ଗୋଟେ ଟାଇମ ସ୍ପେଣ୍ଡ କରିବା ପାଇଁ ଗଲା ଟାଇମ ପୁରା ଟୋଟାଲ ସବୁ ବନ୍ଦ
କିଏ ଗୋଟେ
ହେଇଯିବ।
ହେଲ୍ପ କରିବନି ଏଠି କଣ
କିଏ ଗୋଟେ
କରିବ?
ହେଲ୍ପ କରିବନି ଏଠି ଆଉ କଣ କରିବ ମୁଁ ଏଇନା?
ଆଉ ଗୋଟେ ତ ବନ୍ଦ ହେଇଗଲାଣି ସେ ତ ଲେଫ୍ଟ ମାରିଦେଲା
ଆଉ ଗୋଟେ ବନ୍ଦ ହେଇଗଲାଣି ସେ ତ ଲେଫ୍ଟ ମାରିଦେଲା ଆଉ କଣ କରିବ? ଶୁଣିଲେ ସିନା ଟିକେ କିଏ କଣ କରିବ?
ଆରେ ତାଙ୍କର ବି ଦୋଷ ନାହିଁ ନା, ତାଙ୍କୁ ତ 12ଟା ଟାଇମ ଦିଆ ହେଇଥିଲା ନା, ତ 12ଟା ବେଳେ ମିଳିନି ନା, ମୁଁ ବି ତାଙ୍କୁ ଫୋର୍ସ କରିପାରୁନି। ସେ କହୁଛନ୍ତି ମୁଁ ପାଞ୍ଚଟାରେ ଜଏନ୍ କରୁଛି।
ହ୍ୟାଲୋ।
ହଁ ମୁଁ କଣ କହିବି ତାକୁ ବାରମ୍ବାର ମତେ କଣ କହିବି? କଣ କହିବି? କଣ୍ଟେଣ୍ଟ ତାଙ୍କୁ 45 ମିନିଟ୍ସ କୁହାଯାଇଥିଲା। ପାର୍ଟିସିପେଣ୍ଟ ସବୁ କହିଲେନି ନାହାନ୍ତି ଆଉ କେହି।
ସବୁବେଳେ ଆମର ୱେବିନାରରେ ଏଇଭଳି ହିଁ ପ୍ରୋବ୍ଲେମ ହଉଛି। ଏଟା ଠିକ ଜିନିଷ ନୁହେଁ। 12ଟା ମାନେ କଣ 12ଟା ପ୍ରତ୍ୟେକ ଟାଇମ ଜଏନ୍ କରିବ 10-15 ମିନିଟ ଆଗରୁ ଟିକେ କଣ ଦରକାର ଥିବ କଣ ନାହିଁ।
ରାତି 3ଟାରୁ ତାଙ୍କ ସେଟିଂସ ହସ୍ପିଟାଲ ଭିଡିଓ ପ୍ଲେ କରିଦେଲେ ହବ କି?
କଣଟା କରିଦେବି ମୁଁ? କଣ କହିଲେ? କଣ କହିଲେ 20 ମିନିଟ?
20 ମିନିଟ ଅଛି, କଣ ଭିଡିଓ କଣ ବ୍ରେଷ୍ଟ ଫିଡିଂ ନଥିବ?
ହଠାତ୍ କଣ କରିବି ମୁଁ?
ହଁ ସାର୍ ଜଏନ୍ କରିବେ।
ଶୁଭୁଛି କି? ମାନେ ଯୋଉ ଭିଡିଓଟା ଚାଲିଛି ତା ସାଉଣ୍ଡ
ଆଲୋ ପାର୍ଟିସିପେଣ୍ଟ କଣ 0?
ଟିକେ ଦେଖିଲେ ଅଡିଓଟା ଶୁଭୁଛି କି ନାହିଁ?
ଏଇଠି 47 ଅଛନ୍ତି।
ଅଡିଓ ଶୁଭୁଛି କି ନାହିଁ ପଚାରୁଛି।
ଶୁଭୁଛି। ମତେ ଲାଗୁଛି କୁଡଣ୍ଟ କଲେ ତ ଭିଡିଓ ମ୍ୟାଡମ ପିଲାଙ୍କୁ ମେସେଜ କରିଦେବି ମ୍ୟାଡମ ମେସେଜ କରିଦେବି ଆପଣ କରିଦେବେ। ମୁଁ କଲେ କଣ ଗୀତା ବେଙ୍ଗ
Baby's demeanor will relax as the tummy film experience remove the baby gently, ask for some help, and relatch the baby with some support till you get the hang of it. As your baby feeds go on, once they've finished, they'll get pauses, will be more prolonged, they get more sleepy, and they'll just stop feeding, push the nipple out when they're done. They often want the other side. It's all going to depend on the appetite and what's going on with that particular feed for that baby and yourself. Don't forget to look in his eyes and help him understand what's going on. Once you've got out of hospital, you may need some further support. Initially, your community midwife and maternity support worker will visit you in your own home. And when you're ready to get out and about, there are lots of local support groups in the Reading and Berkshire area. Take a look for a list of current support clinics. Thank you for watching.
Ladies and gentlemen, we are having a great opportunity
to listen to the words by a great knowledgeable speaker,
Dr. Sunil
Sunil Agrawala, Associate Professor, MKCG Barampur, Odisha. So has completed his MD in pediatrics,
honors in
honors
physiology,
biochemistry, pharmacology,
and
and microbiology.
He was
He was awarded with
Fisher
Fisher Gold Medal
Award,
Award,
Harihar
Harihar
Award,
Memorial Award,
Vishnu
Vishnu Priya Devi
Memorial
Award,
Dr.
Dr. Gopal Chandra Patnaik Trust Award,
Chikis
Chakis Ratan Award.
Saha joined as
Joined as lecturer
since 2000
2000
and
and continuing
at
at
MKCG
MKCG Medical College. So has taken many trainings like PPTCT training, HIV and art, NILS and Pulse, ADVOC
and
and SOV,
etc.
etc.
There are
There are more than 51 publications
in
in Indian Journal
and
and more than 40
publications in
in international journals in his name.
I request
I request Sir
to
to enlighten
our
our
delegates
delegates
on
on the topic of newborn care during COVID era.
Over to you.
Over to you, sir.
Thank you, Dinabandhu, for your nice introduction. It's my privilege to have with you all regarding a topic presentation which is dedicated for newborn care and COVID. So, first of all, I congratulate the total team of nursing, Som Hospital, who is especially Suchismita ma'am, who has connected me all along the way for this show. And there is no end to the knowledge. Please tell me, yes, am I audible?
Yes, sir.
Am I
The
audible?
slide is visible and your voice is audible, sir.
Yes, yes. So I will tell you this journey of mine regarding the topic allotted to me, newborn care during COVID-19. As you all know, this 2020 is becoming a new year for all of us, where 217 countries across the globe has affected by an invisible virus, that is COVID-19. And everywhere there is an havoc. What will happen to my kid? What will happen to my child? Whether the vaccine will be given or not. Many houses are being suffered because of this COVID-19 pandemic, where somewhere the grandfather has died, somewhere grandmother has died, somewhere the father and mother both have died. Few houses, they are personless. There is nobody is available. Everybody died because of this COVID. So likewise, we have to know today that what is going to happen during pregnancy, what will happen to the newborn baby after delivery during this COVID mother or COVID pandemic. And what are the things we can give good care during this COVID pandemic, particularly in connection with COVID. So I have designed this topic for 45 minutes into these headings. That is COVID pandemic a little bit, newborn care, baby of a COVID mother, breastfeeding during COVID, vaccination is huge, and what are the points so that we all will be safe, including pregnant and lactating mother and the newborn. So here, this coronavirus pandemic, what are the little bits we must know? Each one has to know much about this pandemic. What do we mean by pandemic? Any disease which has an outbreak and a pandemic potential, I mean global potential. It can affect from one country to another country, one continent to another continent. That is known as pandemic. This is not the first time pandemic occurred in the history. Every 100 years, the legacy continues. I mean, exactly 100 years back, 1920, there was pandemic of Spanish flu. Before 100 years, there was pandemic of cholera. Before that, there was pandemic of plague. So likewise, every 100 years, the history repeats. And this time it has happened in the year 2019, last year, towards the end, that is December. And the first case has been detected in the Wuhan province of China. And that's why the name is 2019 virus. And this coronavirus is a virus which is the next common cause of common cold. We know everywhere. If you go in the winter season, you can return with mild headache, mild coryza, and cough and cold. That is common cold. And this common cold is caused by nobody, only rhinovirus. But next common virus to it is coronavirus. And this coronavirus, which has affected the whole world, which no human being has immunity to it, antibody to it. That's why everyone has to suffer, either by infection or the antibody will be detected in the body by vaccine. These are the two ways we have to protect ourselves. So now this coronavirus, the name has came from the Latin American word. That means corona means crown. And the surface of this virus has a lot of spikes, and they are known as spike proteins. And this virus, before 2019, was a zoonotic virus. And this virus was present in bats. You know, in this planet, bats are the house of lot of viruses. Whatever pandemic you say, Hong Kong pandemic, SARS, COVID, SARS-1, all of them has been originated from this bat. And the close proximity of bat, camel, pangolin towards the human population, these viruses which used to cause common cold in the animal population known as zoonotic cycle, during the phase of multiplication year after another, what happens? There occurs mutation. So this mutation sometimes causes human pathogenic, and because of that, once it enters to the human mucosa, respiratory mucosa, it can attach. But previously it was not able to attach. Because of mutation, there has been change to this coronavirus, and that became a mutated form. The last one is a mutated form, and this became pathogenic to human. And this has been originated first time in the Wuhan. That's why many people will tell you it is a Chinese virus, it is a China-made virus, whatever you say, coronavirus disease. Why it is two? Because COVID-1 was there in 2002. At that point of time, a lot of countries have been affected by this virus, that is COVID-1. I mean, that was SARS-1, and this is SARS-2, or we can say COVID, SARS-2. Coming to this pandemic, this has caused havoc throughout the globe. Already I told it was a global threat. As of now, more than 5.4 crore people have been affected. Until now, today morning, near about 13 lakh human died because of this COVID globally. Coming to Indian scenario, we have 88 lakh positive as of now. Having second position, followed by, the number one being America, followed by is India, our country, and near about 1/10 of the global death, that is 1.3 lakh death, has occurred in India. as of now, no treatment, no robust specific treatment available for this viral disease. We have remdesivir, we have favipiravir, we have plasma therapy, we have monoclonal antibody. So many things are there, but no one is classically designed for COVID. And right now, though China and Russia claim that they are having COVID vaccine, but still the phase 3 trial is on in our country, and maybe in the next month or the first quarter of the next year, we'll be having COVID vaccine in our country. So this disease is not that lethal in comparison with China flu first 2 and thereafter 2012, but it is highly contagious. That means if suppose somebody is having COVID virus inside, then if suppose somebody is there within 2 meter distance, or you can say 6 feet distance, then definitely the chances of having this infection is very, very high. It is a droplet infection. One human being, during talking, during singing, during sneezing, they let out this virus into the air, and these bigger droplets are the viruses. They enter into the respiratory tract of the another person, provided they are in the vicinity of this boundary of 2 meters. And that's the reason we used to say there is 2 meter ki duri. Why? Because of this droplet that do not go beyond 2 meters. So that's why the chances of infecting the other will be difficult if the human distance is maintained 2 meters. What is the incubation period of this virus? This is on an average 2 to 14 days. So that's why the 14 days quarantine has come. If suppose somebody is having symptom today, then he or she will be in home quarantine at least for 14 days, because maximum incubation period, we know that it will be 14 days, and it has been seen. The first 11 days of symptom, they are infective to the others. Even if they are COVID positive, 11 days after, a threat to disseminate this virus to the others. I'll tell you some 2 terminologies we are using in our clinical setting, ILI. Everybody you know, personnel, I mean, you know some terminologies. Didi, jao wo ILI patient ko dekh ke aao. What does it mean? This is ILI, influenza-like illness. So this terminology has been coined by WHO, and it has been taken up by the ICMR, Indian Council of Medical Research, in the month of May. And this ILI previously was known as fever and cough. But remember, no ILI to be admitted. All ILI to be taken care at the domiciliary level, and if they are coming to the OPD, then and there we have to segregate them whether they belong to the COVID category or non-COVID category by virtue of so many presentation of them, so that we prescribe medicine or testing or tracing, and they will be disposed for home care. But any ILI requiring hospitalization, they are known as SARI, severe acute respiratory infection. So if I say onwards now, ILI, cough and cold, not requiring hospitalization, SARI patient, they require hospitalization. Any ILI, any cough and cold admitted with COVID positive, they are known as SARI. These SARI patient, usually they require after hospitalization, sometimes because of hypoxia oxygen, some will go for ventilation, some will require for critical care management. So we have to remember, COVID virus once enters into our respiratory tract, it infects the upper airway, causing cough and cold. Sometimes it goes to the lower airway, causing pneumonia. But I will tell you, this is the presentation. 80% cases are mild, or few of them are asymptomatic at all. In small children, newborn and kids, they are usually asymptomatic or mildly symptomatic. Severe presentation will be in 15%. Only 5% they need critical care management. So that's why it has been told that the previous slide, which I have told you, that it is exactly not lethal, but highly contagious. And I will tell you, as the age advances, the lethality increases. But as the age goes down, the lethality decreases. So to say, in children population, in child population, it do not cause that much of mortality or morbidity. Why? You know, this virus will enter, it will attach to the mucosal surface by a receptor. And this receptor is ACE2, angiotensin converting enzyme receptor, ACE2. If receptor nahi hai, how they can come and attach? So that's why the population of receptor for the attachment is very, very less in smaller children. So that's why if the virus comes also, they cannot attach. So the number of copies of the virus will be less in children. So that's why they are mildly symptomatic or asymptomatic. Another thing is that the difference between child having flu and the adult having flu, usually the adult, they are having a respiratory presentation, but 20% of the kids, they may present with diarrhea. This virus can enter into the GI mucosa and the GI tract mucosa can attach them because of the same SE2 receptor. And they will present with pain, abdomen and diarrhea, not having respiratory complaint. So we have to remember that the maximum adult, they present with respiratory complaint, and 20% of children, they can present with diarrhea with COVID symptom. So this, if I say you, what are the signs and symptoms of coronavirus in babies? Because we are more or less discussing newborn care. That means they will be having pneumonia-like presentation. A small baby or a newborn will be having cough and cold, yes. They may not have anything, only asymptomatic, or mild fever will be there, mild cough will be there. Sometimes vomiting and diarrhea, already I told, low muscle tone, just like sepsis manifestation, not feeding well. So these are not the telltale sign of COVID. Any infection in a baby who are supposed to be known as danger sign, like abdominal distension, vomiting, you say tachypnea, more fast breathing, having saturation low, whatever you say, these are symptomatology and the finding of sepsis and danger sign in a newborn. All will be amicable to a symptomatic baby, but this is not a real and common entity in a case of newborn, because I have already told this virus is not able to attach because of paucity of receptors. So if you see what is the case fatality rate, case fatality rate above 80 years, it is around 15%. Then 70 to 80 years, 8%. As the age goes down, now you see 0 to 9, 0, and up to 20.2. So almost 0 to 20 years, first 2 decades of life, the death is 0.2. That means 2 in 1,000. So mortality is very less. So you need not worry about neonatal presentation, childhood presentation of COVID or toddler presentation of COVID. Either they are asymptomatic or they are mild symptomatic. None of them usually go to. Who is at risk of infection? Anyone, any human being is at risk of infection in a hospital. Not only the healthcare givers, doctors, nurses, pharmacists, those who are working in the, class 4, class 3 employees, all are vulnerable to acquire this infection, because this is a human pathogenic virus. Any human being having a respiratory tract, having this SE2 receptor, they are a threat to acquire this infection. So everyone. So what are the percentage of we means you are the nurses, we are the doctors and the pharmacists and the class 3, class 4 employees. They are grouped into this healthcare personnel or healthcare giver in India. Of the total number of positive, I told 88 lakhs. Out of them, 1% are contributed by healthcare personnel, and they are the first line warriors. So if the vaccine will be available, first the vaccine will be given to this group, healthcare givers or healthcare personnel, starting from doctors, nurses, pharmacists, and down the line, Asa, Didi, and Anganwadi workers in the periphery level. So if we say this, then the next person will be police, then third one will be the first line warriors, those media people, they are working in the periphery setup day and out. And you can say village people, all the social help activists, they are there. So they are the person to be vaccinated first time when vaccine will be available. So something we have to know, that respiratory hygiene and etiquette. If suppose somebody prior to COVID era was sneezing in front of a mob and telling, excuse me, that if suppose somebody so bend the elbow can sneeze. If there is anything, so disposable paper will be there or handkerchief will be there. So you can, although your secretions nasal will be inside that. And once you are using disposable paper, that has to be disposed in a proper covered basket. So mask for caregivers. Any doctor, any nurse working in the hospital scenario must use mask. This mask is not for public. I mean to say either the mask is N95 or the mask is 3-layered surgical mask. Whatever surgical mask, you must be knowing that green one. Everybody knows that. but this is a surgical mask, but this is a N95 mask. What do we mean by N95? 95% of the particles do not enter into the mask. So that is not an N95 mask. But for the public, mask or homemade cloth or mask, homemade cloth for mask is possible. That means only N95 or surgical mask is advisable in the hospital campus, hospital setup. But otherwise, once you are going out, not to the hospital, then normal cloth made mask is possible. That will be enough. N95 versus surgical mask, definitely N95 is better because N95 is otherwise known as respiratory mask and it has a respiratory device inside, and always we inhale but we exhale through that respirator. And that's the reason if in community it is not being advocated now, Government of India has banned the use of N95 mask in the public, because if you are positive and someone is positive, they will exhale this virus into the community through that respirator. So that's why it has been assumed all healthcare givers are negative. That's the reason N95 or surgical mask is acceptable. Regarding the gloves, we know that the gloves has to be worn because at least whenever nurses, doctors, they are working in our day-to-day work, at least we should have a mask and gloves in our hand. Why? Because most of the healthcare givers are working in non-COVID hospital, in non-COVID OPD, in non-COVID setup. But only those who are working in you can say COVID hospital, dedicated COVID hospital, then only they have to wear the full PPE, that is personal protective equipment. Minimal protective gear for all of us to work to save our life, because I always tell that save yourself. Then only you can save your kids, save your family, save your husband, save your wife. Then comes your patient, then comes your community, then comes your nation. If you are not there, already you acquired this virus and died, and because of this, then what the world is left for you? So, my dear, all healthcare givers, all nurses, all viewers, or all listeners, I urge that always do not neglect, as long as this COVID dangerous virus is available, at least we should protect ourselves, at least by mask that's suitable, N95 or surgical, this one is surgical mask. This will be enough, or along with this mask or gloves, any combination. Minimum, these two things has to be there. COVID hospital, once you're working in COVID hospital where all are positive, these nurses, everybody has to wear full PPE, full, starting from head, you can say that head cover, shoe cover, then gown has to be used to protect an individual. That is full PPE has to be worn. So till now, whatever I told, this is a little bit of COVID and coronavirus. And we know that if I go for now corona testing, I may be having corona positive, but this corona is not exactly coronavirus disease 2, SARS-2. Why? Because second commonest cause of common cold in human being is benign coronavirus. But the virus which is pandemic now, that is a special category. That means if it is a set of corona, only one portion of it will be dangerous or mutated form, that is known as COVID-2. And another group was known as COVID-1, that has occurred in 2002. So if you say now, 13 lakh people has died. I will tell 100 years back when there was Spanish flu, that was because of H1N1 swine flu, that virus was there 100 years back. That has taken 5 crore death. And out of that, 2 crore death has been contributed by India. Now we are contributing 1.3 lakh death. So it's a big number. There are many guidelines have come, CDC guideline, American Academy of Pediatrics, WHO, Government of Health and Family Welfare, ICMR. But my dear viewers, that whatever guideline today, what I am talking today may not be true for tomorrow. So use your common sense, always update yourself. Now we are telling the N95 mask is not for public, but it was allowed in the beginning of this COVID pandemic. So guidelines are frequently changing, but we have to know that what the recent guideline we have to update ourselves. So Ministry of Health and Family Welfare, they had this guideline, breastfeeding and newborn care in the context of COVID-19. So first of all, what is the need of the hour? let us concentrate now one part of life, particularly in a woman, is safe motherhood. Who is a mother? That means starting from the day of conception till delivery is a pregnant lady, and thereafter she is a lactating mother, then thereafter she became mother throughout life. So I say there is a separation of a kid from the mother at birth because of the cord has been separated. The bondage between the mother and kid is the umbilical cord that has been separated at birth, but real separation occurs once the mother goes to heaven forever. That is the real separation. So what I mean to say, that was a little bit what can I say, mythological, but I want to say that this motherhood is a dream of each and every woman on earth. No woman on earth doesn't mean that they are not happy without being married or without having a safe motherhood. So this is the need. I can say this is the need. So taking into consideration of COVID-19, this will not be a bar. So now coming to one by one, the lady says, I am pregnant. How can I protect myself against COVID-19? This is being pandemic. So it has been told, wash your hands frequently, same. Why you wash your hands? Because this virus is having a lipid layer. Already I told. There are spiky processes are there. They are glycoproteins. If you wash your hands, there is a saponification. And with this detergent, with any soap, it's not even Lifebuoy soap. If any soap, whatever the quality of soap, even your Vim bar, whatever detergent, if you wash, whatever, immediately there is a disintegration of the cell membrane and the virus structure will disintegrate and die. The same thing with the rabies virus. If suppose somebody comes to us with an animal bite, we tell fresh tap water or fresh water, washing the wound at least for 15 minutes. But here you have to wash for at least 20 seconds or 40 seconds. Avoid touching to eyes and nose and mouth. Why? Because our hand always is a mobile. So now these are the gate of entry of the virus. One is eyes. The virus can enter through eyes. The virus can enter through nose. The virus can enter through mouth. So if I have touched, suppose a COVID positive person is there. Now she had sneezed before me. Now the virus has came and it has been contaminated my hand. Now I have not washed my hand. And if I do like this, if I do not handle or touch my face, then definitely I will not have COVID positive in spite of having a lot of viruses on my hand. And at the end, I will wash my hand. So that means that all will be eliminated. So that's why do not touch your face person. That's why wear a mask? Because if you wear mask, then definitely there is a tendency that will not touch eyes, nose and throat so frequently, which is a habit of us, that if anything goes wrong, we are touching our fingers over the face. That will be minimized. Then person to person, if a pregnant lady, then definitely she will not come in contact with another lady or person, at least within 2 meter distance. That is why I told the droplet infection is maximum between that. So what should be done? The main thing is that she should wear mask if she is out, and definitely all the persons, all of us, those who are COVID negative, or you can say we are protecting each one of us. Then if this end and that end, if both are, one end is COVID positive, another is COVID negative, if both of them are having a mask, then the transmission of virus chance is very, very minimal. And that is even that can happen with cloth-made mask also. So social distancing. Then cough etiquette. If suppose somebody is a pregnant lady is having going to go for a cough, then she has to maintain cough etiquette. Either she will bend her elbow like this, or she will put her handkerchief or disposable papers on the nose, and that has to be disposed to the covered disposable box. In nutshell, I will tell, during pregnancy, one has to follow what a normal regulation or regulatory guidelines has been, or ICMR. That is, number one, do not go out from the home if it is not required. Do not reach to an area where gathering is there, because there is a chance. Do not go to a place or a hotel or a temple where chances of more or a lot of people gathering will be there. Wash your hands once you are entering into your house. properly. Do not touch your face so frequently, and maintain 2 meter to wear mask. That means the social distancing, mask, and in between sanitizer to wear mask. That means the social distancing, mask, and in between sanitizer, because it is not every time you will wash because that facility is not available. So in between you can use the sanitizer. A small pack of sanitizer should be there with you once you are going out. That means this simple methodology, as long as we are not having vaccine, as long as we are not having specific medication, this has to be followed by a pregnant lady during pregnancy. So before, during, and after childbirth, all women have the right to high quality care. Yes, this includes antenatal and intrapartum care, newborn, then postnatal care and mental health. It has been seen that many mothers during pregnancy, during lactation, what happens? There occurs a lot of hormonal changes. Oxytocin, prolactin, then estrogen, progesterone, a lot of changes will be there. So there are mood swing is a possibility during this stage of life, motherhood. Now, if you do not give good care during this, what happens? If the simple viral fever, non-COVID fever comes to a lady, she will be thinking in her brain that she had suffered from real COVID, and she will be mentally, agony will be there. Actually, she will mental anxiety and may go to depression. And this is not uncommon. It has been seen that not only this pregnancy group or lactating group, even normal cohort, because of staying in home for a pretty long period of time and utilizing this electronic gadgets, particularly this mobile, this laptop and all. So they are going for mental trauma and mental anxiety and depression. Even many have gone for suicide. So during this phase, a lot of interaction should be there from the family end, from the caregiver end, and then only we can help each other, and we can help a person not entering into mental agony or mental anxiety or major depressive disorder. So this newborn who is coming out as a product of pregnancy needs to stay in this world as a COVID negative status. So now if you say the mother is COVID positive, there is every chance the baby can be COVID positive. But always remember, this virus never go vertically. If HIV virus, that can go either antenatally, via placenta, or during delivery, or during breast milk, because breast milk also contains HIV. But this is contrary to that. This COVID virus neither enter into the pregnancy, nor it will go via blood, nor it will enter through breast milk. So the placenta and the breast milk do not contain COVID virus. So that means we can easily allow the newborn to be attached to the mother, like kangaroo mother care, to be staying with, rooming in, lying in, to be staying with the mother and taking breast milk, even if the mother is COVID positive. Why? Because this is not a blood-borne disease. So you can give. So a baby is negative. There is how you are sure? Because all the research paper has been told that the baby who is born, it has not been seen, excepting one few single-digit number of cases globally that they became positive because of the mother. But we will not consider that. Let us consider that this is not being transmitted via vertically or via through the breastfeeding. So every newborn has a right to take immediately early initiation of breastfeeding, so that within as soon as possible, even in a cesarean baby, the mother, the cesarean section is going on. Once the mother is okay, then definitely, and the cesarean part is over, then definitely you can put the baby to the breast. So that early initiation of breastfeeding allow the reflexes to go hand in hand, and that should be in such a way that it will be stimulating all the reflexes, sucking, swallowing, and coordination of reflexes, so that the baby can suck in such a way. The first part of the breast milk, that is colostrum, will be given to the baby. So this is the need of the hour. What are the principles of care at birth? Establishment of respiration. Once the baby born, everybody is interested. Pilla kandilana nai. What does it mean? Establishment of respiration has occurred or not. If the baby cried vigorously, we tell vigorous baby, 80-85% of babies, either by normal delivery, either by cesarean section, they cry immediately. That means we always love that baby cried, baby kandilana nai. Jodi baby kandila, then we know that establishment of respiration has occurred. Initial steps has to be geared up, and definitely we can receive the baby in a pre-warmed tray, and we can cover the baby. There are no indication nowadays for the going for the bath, and you have to prevent hypothermia because this newborn is having a long, large surface area. So you have to cover the baby, head cover, then you have to cover the body, trunk, and even your hands and the legs. Every part of the body has to be covered. Then immediately we have to put the baby to the breast as soon as possible. And this known as breast crawl. So what do you mean by breast crawl? Even in normal vaginal delivery, during the episiotomy, wound is going on, stitching is going on, the baby can be put immediately over the breast. The baby can crawl to the breast because of the fragrance, because of the smell of the this nipple. They can go to the nipple and they can start sucking. Establishment of breastfeeding. If you delay that, all these reflexes will be inactive. Then the breastfeeding cascade will be there. I mean, the negative cascade will be there. Then establishment of breastfeeding will be an issue. Do not ever allow any prelacteal feed like Janam Gutti, Mahu Pani. Sometimes in preterm baby, we know all nurses, all doctors, we all know that there occurs physiological lack of breastfeeding in the initial 3 days of life. This has to be told to the mother. Jodi amo pilar darkar jetiki calorie ei gotiye chamoch ba gotiye bunda khilare achi. So prathama 2-3 din khira kam hobo kintu ame jette besi thora lagaiba sete besi khira hobo. It is a practice nowadays all over the country that in nursing home once the baby is born with cesarean, but this is not a good practice because anyhow Jodi mother has got a lot of antibodies throughout her life, and this is rich, the colostrum should reach to the baby. Otherwise, we are not creating a good platform. We are not creating a good basement so that the whole life depends on that. We know that nowadays 1,000 days of life, that is starting from the day of conception throughout pregnancy, 9 months, then first 2 years of life. This is the crucial period. If suppose you take care of this period, then definitely the adult onset of diseases like diabetes, hypertension, coronary disease, kidney disease, all will be minimized. So this is the need of the hour. Now, if you go to the urban, the chances of the percentage of breastfeeding is less. I have seen many educated mothers, even doctors, even nurses, this first crucial part of life, 2 to 3 days, they usually take care of top feeding, then gradually they do switch over to the breast. This is not at all good. Never deprive any newborn baby from the colostrum. It has to be given. And you, the people, we are here in a seminar or webinar that we can talk. I can talk throughout a whole day, but it's of useless if you do not practice at the practical point. So ground level, whatever knowledge you possess, that has to be disseminated. You are there in the MSc platform or BSc platform and you are learning, and this has to be disseminated to your youngsters and to other nurses and other caregivers. Then only we can have that this generation which will be coming, definitely they will be disease free, they will have a microbe in a better way. What are the prevention of infection? If I will say I am Agarwal, in my custom, in my race or in my religion, what is there in 21 days, Ekusia. So once a lot of people, and by the time everybody goes out, by 22 or 23 or 20, be sick and suffering from sepsis, and whether the baby will be going to survive or not, it's a questionable. Identification of arteries. Suppose somebody is having any risk or facial dysmorphism, major congenital anomaly, or you can say preterm baby, or you can say baby, this has to be handled with care. So this care at birth is very, very essential. We have to follow, even if in COVID or without COVID. Sometimes in the initial part of COVID pandemic, I will talk that month of January, February, March, when the India has not seen cases of COVID by that time in China, there was a separation of the baby from the mother, thinking that the baby will be contaminated by these droplets of the mother and baby will be dying soon. Because we have no knowledge that this COVID is either asymptomatic or mild symptomatic in a baby. So now, over this span of 10 months experience with this is the guideline that zero separation. That means mother and baby, if the mother is COVID suspect, or the mother is COVID positive, or the mother is COVID negative, we have no right to separate the baby from the mother. That means baby and mother has to be kept either, what you say, kangaroo mother care, or moving in or lying in one cot, in one bed, baby and the mother has to be there. Why? These bondage, that means the microflora of the mother will be in vicinity with the baby. That will protect. Baby will get warmth. Then it has been seen, lot of papers, lot of trials are there. Kangaroo mother care in less than 2.5 kilo babies is very good till 2.5 kilo baby. The growth, the development, everything, I mean the IQ, everything will be better than without kangaroo mother care. So we have to go with that. Initiation of breastfeeding is early and the continuation of breastfeeding is prolonged. So that every advantage, these all advantages were not taken in care in the initial part. Now it has been seen, if you separate them in fear or due fear of COVID acquirement, then we are doing harm, because baby is deprived of a lot of things. All this breast milk, which is rich in so many advantages, that will be deprived and baby may die because of sepsis. So that's the reason separation is not allowed. What is the baby care after bath? So once the bath is there, some apply your rasi tela, some apply surish tela. All telas are equal, but scientifically it has been proved that coconut oil is the best amongst all. Apply moisturizer. Now we are heading towards winter, so definitely what you say, the best moisturizer is the coconut oil. Give only sponge bath, not like whatever in initial part of the days. Once the baby is more than 2.5 kilo and the baby is vitally stable, we should allow bath every day, but head bath once a week. Breastfeeding on time, it is demand feeding, but if the night feeding is important. But dealing with a term 2.5 kilo, then keep night feeding. Keep hand sanitizer handy, because many times you are handling your baby, your hands are dirty. Because we are touching. The touch is a reflex that anything in our front we are going to touch. So anytime we are handling, because of this COVID, because we have to clean our hand with the sanitizer. Do diaper change. Some mothers, educated mothers, what they do, apply 4 or 5 diapers a day, and every time they apply 24 hours diaper will be there, and in the long run they will land up with diaper dermatitis. That's not good. Only in the night time for certain hours or intermittently it is allowed. 24 is not the ideal one. Do not touch until the mother or another dedicated caregiver like mother are allowed to touch the baby at least for 6 months. This is very, very important. Otherwise, frequent touching will cause more harm, and probably we are giving infection, nothing else. The cord, the umbilical cord, nowadays we should not apply anything to the cord. If at all, yes, it is rectified spirit, nothing else. Previously, the days were there 20 years back, it was Jensen Bowlet. So nowadays we are not applying that. The best thing is rectified spirit, or you do not apply anything. So warm chain, it has been told, no, the vaccine from the manufacturing point till the consumer, that is cold chain, that everybody knows. So what is the warm chain? The mother and the baby should be kept together with skin to skin contact. That is a part of KMC. And if the mother and baby has to be sent or has to be referred to the first referral unit, then both of them should be sent in a warm environment. So that is known as warm chain. So if you do not maintain warm chain, then they will die of hypothermia, because we know the conduction, convection, and reflection, all those are high in cases of babies, and they will end up with hypothermia. So coming to COVID-19 and breastfeeding, I have already told, even if COVID-19 positive mother, whether you will go for breastfeeding or not, let us discuss. I have already told that breast milk does not contain COVID virus. It is not coming through placenta, neither it is coming through breast milk. But there is a trick, because the mother can snitch. The mother can go for talking with the baby. I mean, go for breathe in front of the baby. So that means mother can disseminate. Now you are telling 2 meter distance. But if the baby is being fed by the mother, where is the 2 meter distance? So that means every time the baby is exposed to the air, exhaled air of the mother, which contain COVID virus. But it has been seen because of paucity of the receptor, the baby is not a candidate to acquire this infection. If at all positive, they are highly symptomatic, or 90% plus they are asymptomatic. No death. Like any major congenital malformation or anything, then virus, then that will allow the suppression of immunity. Then there will be superadded bacterial pneumonia. They can die. But on an average, the death is not common, because already I told 0 to 20 years, the death tool is 0.2 or less than 0.2%. So breast milk provides protection against many diseases because it contains lactoferrin, it contains your antibodies, it contains neutrophils. All protective factors are there, and these protect the babies to the tune of at least for 1 year of life. Keep breastfeeding even if you are sick. If the mother is sick, suppose she is a mother, suppose the mother is eclampsia and now eclampsia and convulsion is going on. So if the mother is not comfortable, you can express the breast milk, and that can be fed to the baby by cutlery spoon or by tube feeding if the baby is not well. So even if the baby is not well, the expressed breast milk can be given. But if the baby is well, mother is well, even it doesn't matter. But here there is a big but. Because there is a chance of transmission, mother should wear what? Mask. Because once the mother is 95% of the viruses, whatever is coming, they cannot come out. That means that is one. Restriction of the viruses coming from the exhaled air will be minimized. That is one. Second, if by chance with a naked breast or naked chest, the mother sneezed, that virus may be there. In that condition, mother has to be washing her breast of the chest. Then only she should be giving a breast. But each time washing or applying the sanitizer to the breast is not required. So can COVID-19 be passed through breastfeeding? The answer is no. Already I told, answer is no, big no. No fear at all. Still be immediately placed skin to skin contact. Yes, we are, one end we are telling that 2 meter duty. Another end we are telling skin to skin contact, because it has been seen this skin to skin contact having a multifaceted, multivarious benefits rather than risk. So we have to weigh a balance between the benefits versus risk. Here the benefits is very, very high, but the risk is very less. So we have to go with this. Breastfeed if the mother is confirmed or suspected to be COVID-19. Yes, following delivery, there is no hindrance with rooming in, no hindrance with lying in, and KMC has to be given without any agitation, but mask has to be worn and sanitizer like other are going away from the home, that has to be maintained. Do the results of COVID-19 testing make any difference to mother is suppose COVID suspect? Same thing. If mother is a branded COVID negative, same thing. If the mother is COVID positive, same thing. But if the mother is not well, then definitely we have to take care of the mother and express breast milk can be given. If the baby is unwell and mother is well, so in that condition, we can go for tube feeding this expressed breast milk. Close contact and early exclusive breastfeeding helps the baby to thrive. This we have seen. Our previous speaker might have told you that breastfeeding versus complementary feeding. Breastfeeding to the tune of 13% of under 5 mortality is reduced, and to the tune of 5% or 6% mortality has been reduced by your complementary feeding. So if you continue this, what I say, first 2000 days of life, that proper exclusive breastfeeding up to 6 months, that means only breastfeeding for nutritional point of view, excluding medication, and thereafter continuation of breastfeeding in addition to proper, acceptable, homemade, the desirable complementary feeding up to 2 years of life. Then we can minimize 13% plus 6, 19% of under 5 mortality can be minimized with this effort only. A woman with COVID-19 should be supported to breastfeed safely, hold her newborn skin to skin, and share a room with her baby. No one should be allowed into that. If suppose someone is going and taking care, he or she must be having the same formula, that social distancing, number 2, your mask, and number 3, sanitization has to be maintained. So women with COVID-19 can breastfeed if they wish to do so. Yes, this has already been emphasized again and again. Practice respiratory hygiene, because I have told this is the way, or you can do like this, or you can do take your handkerchief and do the sneezing into that, not like a open sneezing to the like a explosion of the bomb. where people will be there, and you have no right to disseminate this millions of copies of the virus to each of them. No, never to be done. So this COVID virus has taught us like Chinese policy. What can I say? Chinese policy, or you can say the Japanese policy. You go to Japan, all the people throughout the year, they are working out from home with a mask. Mask is a must, and they are not touching their hand again and again to that. Once they enter into the home, they wash their hands, they enter. So whatever policy we are maintaining now, whatever guidelines we are maintaining now, the same guideline has been maintained in Japan for years together. And that's the reason the incidences are so high in Western world, that means flu, that is not that high in eastern part of globe, that is Japan and ancillary countries. Wash your hands before and after touching the baby. If you are going to touch the baby in COVID-19, so wash your hands. Routinely clean and disinfect surfaces. The surfaces, because you know these droplets, they deposit on the surface and they can alive, these viruses can be alive for at least 1 to 4 days. We do not know in different surfaces. This should be mopped out and cleaned with a hypochlorite solution at least once a day, as long as you are not free from COVID. If a woman with COVID-19 is too unwell to breastfeed, then how you are going to hide? She can be supported to safely provide her baby with breast milk in other ways, like EBM, expressing breast milk. Now, how to express them? If I am positive, I am a mother, lactating mother, so I have to wash my hands. Then I have to wear the mask so that I cannot, I will prevent the sneezing, and the breathing, exhale air should not touch or let down over the breast. Then I will squeeze. I will squeeze backward so that the milk will be ejected out and it will be collected. Usually in our scenario in Odisha, we do not prefer this breast pump regularly, because this is the way you can express. Nowadays human milk bank has already been started in Odisha, starting from your capital hospital and other part. Here in Berhampur, we are planning to do this initiation of bank, so that this milk from the mother can be stored and it can be given to the needy preterm or the needy newborns. Relactation. Sometimes the mother, because of her disease, is not able to feed, and once the mother is comfortable food and the relatching, everything can be possible. Then donor human milk, I have already told, like blood bank, like plasma bank, the donor human milk bank is available in connection with COVID. There is no harm, no choosing the breast milk and keeping them in the bank and giving to the needy babies is not at all a risk. Breastfeeding and COVID-19, that breastfeeding is an ideal way to give the survival of 13%. I repeat always that this has to be kept in your brain, kept in your mind, so that we'll love to tell that breastfeeding alone, Ma khiro atoi amruta samano. So never underestimate the breastfeeding all over the world. Jette ame pandito hoche, jette pato poduche, we are just thinking, we are just analyzing what is there in the breast milk. Why? Even if you are going for non-XLF or some brand from some good houses, even if jaha kalebi, it cannot be comparable with the breast milk. It is rich in treasure house of all items, whatever is needed for the growth and development of the baby. It is not only physical growth, but also mental growth. It is rich in lysine. It is rich in leucine. It is rich in methionine. It is rich in lactoferrin. It is rich in your, you can say, this whey protein. And it is rich in probiotics and prebiotics. So these all help. So Jodi Makiro Daba Pratham 6 mas, even in connection with COVID, definitely we can increase the babies. Breastfeeding protects babies when they are sick, when others around them are sick. That means baby is getting all the passive ingredients, nutrients, so that they will help and increase as long as the baby's immune system is not mature enough. So fewer childhood vaccines have been given during COVID-19 pandemic. Every time the mother tells more COVID positive balla, mo chua ko BCG or hepatitis B devina ni. Yes, tabo kain tabo ni. Babies the more chua mo ticket test kar debi kari pariba ame. First test to be done at 48 hours. That is again antigen test, nasopharyngeal swab to be taken. We can go for RAT, rapid antigen, or you can go for this PCR, RT-PCR, reverse transcriptase RT-PCR, real-time PCR, that can be done. So if the baby is not symptomatic, there is no point of doing this test. If the baby is symptomatic in the view of ILI, what is ILI? Influenza-like illness, cough and cold or fever will be there. Then it is allowed that if the mother is positive, there may be a chance of the baby can be positive. Then only also the same thing has to be continued. But there is no specific management for COVID for the newborn baby. If baby is tachypnea too much, we assume there is bronchiolitis or any infection, then the baby has to be treated with oxygen therapy and IV antibiotics and humidified oxygen. All vaccines, if the baby discharged without any, suppose the baby has born on day 2 we have done. So for academic point of view, you will be satisfied, the mother will be satisfied, my baby is negative. So that gives a satiety, that gives us a satisfaction to the brain of the mother that she will be happy that I have given birth to a baby who is negative. Though I am positive, but I will take utmost care that my baby will be positive throughout. I mean, my baby will be negative throughout. That will be my dream. And that's why she will be taking care very good. That means mask will be there and sanitization she will follow. Regarding vaccination, everything will be, if you tell that the baby is positive today, it is a viral, then also this vaccine will be given, provided the baby is not sick. If any baby is sick or any baby is having moderate to high grade fever, vitally unstable, then vaccination will not be given. That is a standing rule that we cannot give vaccine to a sick baby, because if the death occurs, it will be equated with the causality that the vaccine has killed the baby, not the disease. So in order to avoid that myth, avoid that situation, we are not allowed to give vaccine those who are unstable babies. So this is the summary. I will tell you COVID-19, breastfeeding in COVID-19 positive mother. I'll tell you after birth, if mother is asymptomatic. I am talking of COVID-19 positive mother. You see here, a COVID-19 positive mother. If mother is asymptomatic, displays few symptoms like myalgia and anything. What will be your answer? Rooming in, direct breastfeeding. Already I told. But mother has cough, fever and dyspnea. She is taking antibiotic. She is taking favipiravir. She is taking now oxygen therapy. In that condition, or the newborn is symptomatic, ICU care, because of prematurity and prematurity-related complication. So in that condition, mother and infant separation transitory, which is situational, then immediately the baby is better or the mother is better, they will be again coming in contact. And in that condition, we can go for EBM, that is expressed breast milk. Still recommend hand washing prior to handling infant, mask during breastfeeding, 6 foot distance when not feeding, and suspend visitors. No visitors are allowed. There is no evidence of transmission of COVID virus through breast milk reported to date, and EBM should not be given as mother can pass antibodies. That means EBM should be given as mother can pass antibodies via breast milk. Because once infection, mother is antibodies and these antibodies, this is indirectly just like a plasma therapy. The baby will be having antibody, and so that the baby will not get these viruses, because viruses attachment will be prevented by the presence of anti-COVID antibodies. Infant recommendations born to COVID positive mothers should have RT-PCR, pharyngeal swab for SARS-CoV-2 weekly until 28 days. The first one after 48 hours, then weekly. But once the baby is going to discharge asymptomatic, there is no need for follow-up, but the danger sign has to be explained at when the baby has to return back. If there is appearance of fever, or there is tachypnea, or vomiting, distension of abdomen, seizure, anything, hypothermia, the baby has to be come back to the facility again. 1 week observation in hospital after birth is preferable, but because of this heavy load, we had near about 100 COVID mothers, more than that, they gave birth. All of them, I say all of them were COVID negative when the test has been done on 48 hours after delivery. Only one baby was a little bit sick. That baby handled well in SNCU, and that baby also recovered and discharged. In initial days in China, this is a line written limitation. Separating. Now, it has been told that if you separate, the baby is deprived from the birthright of the baby, that is the breast milk, and the warmth from the mother, and the antibodies from the mother, these are all deprived. Not die of COVID, but may die of infection. So that's the reason. This is a beautiful slide coined by WHO. and it has been adopted by so many, almost all countries across the world. What are the principles of family-centered care? Now everybody tells home quarantine, home quarantine. The government is also telling if you are having mild symptoms or no symptoms, you can manage home. If the pregnant lady is COVID positive, having no symptoms, she can be managed home just like a normal delivery. She will go back to her home if it is a product of normal vaginal delivery. Sure, they become the health caregivers, that means nurses. You, the people, are very, very important, so that you counsel the mother in such a way that anything wrong, they can come. Here, level workers, Asa Didi, these village health workers, they are very, very important to follow up those mothers at home. That is known as family-centered care. Here, collaboration members and the mother is important, because if there are negative forces like Sasuma or like so this has to be taken handled with care, just like glass, handled with care. We cannot disrespect them. We cannot tell anything odd to them, but we have to respect them and we have to handle with care. Then only our main objective, that the baby survival, even if in COVID era, has to be there. And this newborn care, I have already told, starting from immediate care, that provide breastfeeding, then thereafter follow up the baby, that no visitors should be a minimum touching and burping, then you allow the lateral sleeping. This all has to be maintained. Then only, and do not deprive the baby from the timely vaccination. It has to be given. So important nursing tips. What are the tips? Do not forget SMS. We know this era of WhatsApp. Every time we are busy in SMS and everything. Many times I have seen my postgraduates, they are writing too much of text and they forget to send. You have not answered me. No, okay, sir, I have answered. Then they will come to know, no, this has been text, has been written in the WhatsApp, but it has not been sent. They are too busy. Nowadays, every human is busy. Nurses are busy, doctors are busy, and the layman is busy. Everybody is busy. They don't have time. And maximum time in our day-to-day life has been wasted, not wasted, has been taken up by these gadgets. And it has been told that all these students or small kids who go for online classes, they are. So minimum of it has been told that the small children, they should be allowed them at least near about 30 minutes or to the having 20 minutes plus, then you should look to a distance at least for 2 to 3 times and come to the gadget. So that will allow your ocular musculature and your fatigueness will be minimized. Always keep a distance. Keep a distance of 1 feet at least between the gadget and between the your eyes. So these small tips, that matters a lot. So not only that this week we are celebrating and we are exposed person by your faculties that you have to stay here, you have to listen here, and you have to go for feedback, how much you have learned. But my appeal to all of you is that come to the reality. Involve yourself in the caregiving. If you are the nurses, definitely you are the gifted personalities in the. I say I am a doctor. It is all because of what best I have done in my previous birth. That's why I got an opportunity to serve this mankind. So I urge that I not forget SMS in my this as long as COVID is not leaving us. So what must do? Physical exercise is very important. Yoga or pranayam in the morning. Work from home. Nowadays, many this technocrats, they are working from home. Care of the seniors. Sometimes we are not giving attention to our seniors, to our mothers, to our grandmothers. But this is an opportunity. Don't neglect them. At least they. Suppose I'll tell going to the mandir and worshipping there, rather than you worship or you give pranam in the morning to your father and mother, you get a lot of blessing where no force can deprive you that you will not go ahead. Decrease screen time. It has been told less than, and always physical exercise to the tune of, not everybody is allowed to this type of instrument or devices, but you can walk either morning, evening, doesn't matter, at least for 30 minutes, 5 days a week. Stay updated, stay fit. If you are not fit, how can you allow your patients to be fit? If you are not mentally sound, how can you tell them that you follow this advice or that advice? That is not possible. So this way you have to have time adjustment, time management. If you are a good faculty, if you are a good student, if you are a good learner, if you are a good housewife, if you are a good employee, then definitely you have to manage time in such a way that every time you will be awarded, rewarded by others. Na, say didira bahut bala. At least smile. Nale kete didi ase no ebe लोगों को कांदिबे लोगों को बाडेबे ये कैसे ना खाली ताको एंट्री टाइम टा बहुत लेट बट एग्जिट टाइम टा बिफोर टाइम that should not be the attitude. Stay updated. So my dear I can say students and all listeners, nurses, faculties, I urge stay updated whatever updation is there. Now we are telling Favipiravir, Remdesivir is the modality of management. Anticoagulant is the modality of management in COVID. Even if they are pregnant or even if they are first life has to be there. Then good behavior, that attitude, behavior, communication, this has to be there from a doctor point of view. This has to be there from a nursing point of view. Because we the doctors come and we doctors for diagnosis, but nurses for nursing care. So I mean again, doctors were there for the diagnosis, but after the diagnosis, the treatment, it has been given to the patient in such a way that they will come out of the agony. A smile will be given, particularly in kids. I am so happy when I see and treat my small kids once they are unconscious and all. And once they will be doing excellent and giving a smile in the next day around, I am the happiest man. Because जो माने छोटा पिला से माने भगवान का सहित तांका सहित कपटता एसबू किसी न थाए. So they are really testing whether आमे पाठ पढ़ीचु ना आम समय एबे समय आमे ढुले की सोईचु. So that is a task, a examination by them to us. So please maintain good behavior. Never ever jodi khai na aji godo bata hochi laguchi maija manare hochi moto covid hochi, but still do not deprive at least a smile to your patient or to your kids. I mean to your even your, I can say, being a nurse, male nurse or whatever, to your spouses, because life is short. This journey of 50, 60 or 70 years, we do not know in which way we'll leave this planet, but we have to do our work day and out so that we will be remembered forever. So present to future dress code, some lighter ways. I have taken here about 1 hour because I can say my person who has me, I'm a doctor, and definitely whether I can reach in time or not, because doctors are famous not to maintain time. But I say those who are good, then definitely they can good in all aspects. So I do not know why I am being called for this platform, but I thought some experience of mine, something I can give to my students or to my viewers, to my listeners, so that at least that will impact something in their life, so that I will be useful and remembered by them. So future dress code. If there is money and poverty, you see this a tribal lady with a small kid having pallor, having a splenomegaly, suffering from recurrent malaria in Kandhamal. This is the way it is. Is it not a mask like? This is cloth-made mask. You can do whatever way you are interested. So if there is a will, there is a way. If you don't have money, it doesn't matter. But if you have a good brain, many illiterate, illiterate and you can say below poverty line are good humans. We are all human beings, but I request, if we are all humans, good, then our purpose of this birth is fulfilled. So you see, in coming days, you will get this type of remonts. Eventually, these big houses, they will be coming with this type of this mask. But never say that mask, you do not forget. If once you are going out, at least wear mask. If you are going to if I am going to my market for marketing something, there is no need of going for a 95 or surgical mask. I will wear the cloth-made mask like my other spouses, my kids. So that once we are entering into the hospital scenario, then do not forget N95 and surgical mask. This is the need of the hour. So once you are getting a pregnant lady, go with them, talk with them. Something they are not able to take any part, neither to the husband nor to the free. You are the nurses, they will tell something to you. Didi moja eta hutala, moto bhari dora maruchi, mo chuata, mo negative, mo to positive achi, mo to bhala achi, mo chuata ko kichu na ho. Ami karna tomo chua ko kichu hobo. Kichu doriban nai. Tanko pai ame secondary wote test call deba. It will be negative, then the moral boosting will be there and we can discharge them. And when tell them when to come. If at any point of time the child becomes sick, they have to run back into the hospital as soon as possible. So best practice for Corona and COVID, leave your eyes, nose, mouth alone. Do not touch them because these are the gateways. Mate jane pachala kansa kanno dwara covid ei paribo? No, nowhere it is mentioned that it goes through kanno. Sir bhagavan eti kona karchandi akhi nako pati kannore kai jauni etinta jauchu, that part I don't know. Eta covid ko pachariବାକୁ padibo. That means this 2 3 and maximum number of viruses that won't do enter through the nose. So that's the reason for nasal swab or nasal and pharyngeal or nasopharyngeal swab. Never touch them without washing hands. ଆମେ ପିଲାକୁ ଧରିବା ଯଦି କ୍ଷୀର ଦେବାକୁ ଅଛି ତାହେଲେ ହାତ ଧୋଇକିନା ଧରିବା। ତା ମଝିରେ ଯଦି ଆମେ ଶୋଇକି ଉଠିଲେ ଟିକେ ହ୍ୟାଣ୍ଡ ସାନିଟାଇଜର ଲଗେଇକି ଆମେ ଧରିବା। To avoid touching, face mask is a must. ଆମେ ବହୁତ ଥର ଦେଖିଛୁ face mask ଲଗେଇଲେ ଆମ ହାତଟା ବାରମ୍ବାର ଏଇଟା ଦେଖାଯାଏ ଯେ ଗୋଟେ ମଣିଷ ଧରି ହାତ ଏ ଯୋଉ ହାତ ଅଛି ନା ଚୁଲବୁଲି ହାତ ଲେଫ୍ଟ ହଉ ରାଇଟ୍ ହଉ ସବୁବେଳେ ଆମର କିଛି ନା କିଛି କାମ ଚାଲିଥିବ। 110 ଥର ପର୍ଟିକୁଲାରଲି जेंट्स मानकर और 100-200 थर पाखापाखि लेडीज मान हाथ खाली आग पछ आग मुहरे से लगाती। सो दैट्स व्हाई इट इज वल्नरेबल जे हाथ जदि न लगे तले हमको होबनी। सो मास्क इज वेरी वेरी इंपोर्टेंट। इफ यू वेयर मास्क टचिंग दिस गेट्स is impossible, so that we cannot allow this virus to go in. So lastly, mask is better than ventilator, home is better than ICU, prevention is better than cure. So this preventive medicine, everything is preventable. एक वर्षर ए जर्नी ऑफ कोविड रे हमें समस्त बंचीचे बिकॉज ऑफ प्रिवेंशन ओनली। ना हमें टीका नहीं ना हमें भावुचे आम देह एंटीबॉडी नहीं, बट ओनली बिकॉज ऑफ प्रिवेंशन वी आर अवेलेबल। एंड आई होप भगवान एमती करंतु सबको आम द्वारा जति सेवा हो पार मानव जाति आम से करूँ। दैट मीन्स गेट वेल सून, रियल सून। So this is from the talk. I hope I have done some justice to all of you. Now it is over to my moderator Dinabandhu, and my all thanks to all the faculties of some hospital, some nursing college. They have invited, and I did something to the use. Will accept whatever my views are there. And Suchesmita ma'am, thanks a lot. At every day and night you are to this place. Really honored to all of you. Thank you very much. If anybody is having any question, I'll be honored. Thanks a lot.
Thank you
very much, sir. Your session was really insightful, thought-provoking, and informative. But there are certain questions some participants they have asked. So can I ask you, sir?
Sure.
On their behalf.
Sure.
So if participants, if you have any doubt, you may ask me now. Otherwise, some participants they have personally messaged me the question regarding your topic, sir. I will ask. So I will give the chance to the participants first. If they have any doubt, they may ask me. Ask you now.
Can we see each other? No, it's not possible.
Yes, sir.
Yes, sir. They can see. No problem.
So what shall I do? Dinabandhu, what shall I do?
No, sir.
They will ask directly. There is a question in the chat box. So if LPW baby or preterm baby is birth with respiratory distress and is under intubation, then how can we provide colostrum to the baby?
Now the question is that always remember, you go with the category of baby. Number one, it is a preterm baby or a LBW baby, is a high risk baby. Number two, how the baby born? Baby born with respiratory distress. Now we do not know what is the respiratory distress is due to, whether it is due to hyaline membrane disease or due to some surgical condition of the lung like congenital diaphragmatic hernia, or it is due to cleft lip and palate, or it is due to aspiration pneumonia, or it is due to the early onset of sepsis. We don't know. Whatever may be the way, if baby is having respiratory distress, immediately it has to be managed in SNCU or it can be scaled up to NICU. In that condition, first, initially, our feeding part is not an issue. Issue is stabilizing the patient. So what we used to do, oxygen therapy number one. Number two, IV fluid, maintenance fluid. Number three, going to the causality of respiratory distress, we have to address that. Now question comes, once the baby is stable by evening or certain time, then only we can initiate the feeding. At that point of time, at that point of time, because the baby is sick, one is preterm or LBW and the respiratory distress, there is no question of baby can be directly latching to the breast or nipple of the mother, and it cannot be done. So in that scenario, once the baby is stable, I underline, once the baby is stable, in case of this type of high risk babies, then we can go to the mother. Somebody has to help out. You, the people are there, nurses know better than me. So you have to go out and make the breast prepared for letting out colostrum, even if 1 or 2 ml, whatever will be there, that can be fed through oral route, that is OGT or NGT feeding can. But if a baby is having tremendous vital unstable hypoxia is there, and baby is having vital, I can say arrhythmias are there, and the baby is in shock, in that condition, the feeding has to be postponed. Yes.
Thank you, sir.
Thank you, sir.
So there is another question. Someone has asked, babies and toddlers, those who are under 2 years of age, whether the mask is mandatory for them because they are not able to use the mask. They have very small respiratory tract, and how they will prevent, or how we can prevent COVID-19 for these guys.
So that is a very good question. I love this question. That we concerned about the mask. Key mask pindibo. Number one, if you go to the WHO categorically mentioned 6 ବର୍ଷ ତଳ ପିଲାଙ୍କ ପାଇଁ mask ଦରକାର ନାହିଁ. Because of the small airway, whatever ventilation, small, everything is small. Small airway, small naka, small party, सब small. So tar bhitere whatever ventilation is there, that is optimal. But if you cover with a mask, they may go for asphyxia-like condition. Not all, some of them. So to avoid that, WHO tell 6 ବର୍ଷ ତଳ ପିଲାଙ୍କୁ mask ଦରକାର ନାହିଁ. Now coming to ICMR, Indian, what I say, Government of India and Family Welfare, they tell 2 years below. That means 2 ବର୍ଷ ତଳ ପିଲା, ଆଜି ଯେ newborn ଜନ୍ମ ନେଲା, ଯଦି ତା ମା କୋଭିଡ ପଜିଟିଭ ଅଛି, ମା ମାସ୍କ ପିନ୍ଧିବ, କୋଭିଡ ମାନେ ପିଲାକୁ ମାସ୍କ ପିନ୍ଧିବା ଦରକାର ନାହିଁ. Even if COVID positive, ପିଲାକୁ ମାସ୍କ ପିନ୍ଧିବା ଦରକାର ନାହିଁ. So this is not mandate up to 2 years in Indian scenario by WHO for the whole of the countries across the globe. They mention not below 6 years. So एठी 2 ବର୍ଷ एठी 6 ବର୍ଷ ଆମେ ମନେ ରଖିବା. That ଯେତେବେଳେ ତାଙ୍କର ଏଇ ଗେଟ୍ ଗୁଡାକ ଖୋଲା ଅଛି, ଆଖି, ନାକ, ପାଟି, I mean eye, nose and mouth, if it is open, they are at risk of getting this virus through air or through droplets or through exhaled air of some other person, maybe mother, maybe father, or maybe caregiver. But it has been seen, because of paucity of the receptor, even if the virus enters, it cannot attach. So even if it enters and attaches, the infection will be very milder one or asymptomatic. They do not die. So that is the reason we should not bother about mask business in 2 years below, in case of Indian guideline, and in case of WHO, that is 6 years below. So on an average, if you extrapolate like that, 6 years and above, when the maturation of these receptors are there, every chance of the virus can go and attach, then the possibility of infection will be high. In that condition, 6 years and above, going out, the mask is a possibility, but not below that. So we have to practice, particularly at least up to 2 years and above, or 6 years and above, the mask can be used. So this is my answer. So don't be going with this message that COVID is not common below. No, COVID is common. COVID can happen to newborn even. I have seen newborn having COVID positive, but they are asymptomatic or they are mildly symptomatic. Why we are going for COVID test in the newborn? It is all because mother is positive. So we wanted to know whether baby is positive or not. But that doesn't mean, even if the baby is positive, to become not allowing the exhaled air from the mother to the baby will wear mask. No, not at all. So baby, regarding mask, that is not a mandate. Up to 2 years by Indian guideline, up to 6 years by WHO guideline. Yes.
Thank you, sir.
Thank you, sir.
So there is another question. The question is whether the N95 are they really able to filter out the COVID-19 virus? Because the pore size is greater than the size of the virus.
Yes, it has been studied. It has been studied that in cases of 95%, I'll tell you, regarding the viruses, this N95 virus, always remember the pore size or whatever we see or we tell, that is not true. I will not agree that the pore size is bigger than the virus, because virus size is virus is very big. The COVID virus is very big. So 120 to 160 nanometer. But the pore size is in micron. So that means micron means 10 to the power 6. And that was 10 to the power 10 to the power 9. So whatever pore size is there, they will not allow almost 100% viruses to enter in. So if I say N95 versus surgical mask, regarding viral entry, it is 100%, nearing 100%, it protect, not allow these viruses to enter. So N95, if you are wearing, you are sure the viruses will not enter. Regarding other microbes, the bacteria or fungus, all these allergen particles, big particles, they will not enter. Always we remember, in cases of particles to enter into the respiratory tract, we divide them two categories. One is less than 1 micron, another is 1 to 5 micron, and another is more than 5 micron. What in MDI, that meta-dose inhalers we are throwing into the respiratory tract, they are less than 5 micron. But they are also generating bigger particles. Now these bigger particles, they are segregated into the upper airway. Only the minor particles, I mean less than 5 micron particles, 3 to 5 micron particles, they go inside the lung. But in a mask, it has been studied well that why 95? Almost 95% of all microbes, including COVID virus, are not entering into the mouth cavity or nasal cavity or nasomouth cavity. So we should not be worried about that. That is the reason. If this virus is entering through N95, then it is a useless thing for all healthcare givers that we should not be allowed to go for this. But we should not go by this. This virus is not going to enter if you are using even a cloth mask. What about N95? What about surgical? Even a cloth mask, that is not going to enter. So something is better than nothing. Best is N95. Next best is surgical mask. Next best is your cloth made mask. All are very good. Even you say theoretically 1-2% can enter, but we have to go with a programmatic perspective. So I will go with this message that N95 mask is very good, not to allow a single virus to enter into the respiratory tract. If you are wearing in a perfect way, there is a seal and everything you are maintaining, not below the nose. Sometimes we are just we do not forget, usually forget where the mask is there. If it is there below the mouth or below the nasal cavity, then definitely it is useless. It will not allow. It will allow. Yes.
Thank you very much, sir. This was really a very nice answer. So, sir, another question I got from the friends that the doxycycline and ivermectin, these are going to be as a treatment they are providing for the COVID-19 as well as for the prophylaxis they are providing. But actually, sir, these are not antiviral drugs. Anyway, so the what you can say, the Tata Medical Hospital, they are considering these are the effective medications. So is it possible that this should be given to the children?
Okay, first of all, let me clarify. Always remember, this doxycycline is an antibiotic. Azithromycin is antibiotics. Now these are being used. Then remdesivir, favipiravir are antiviral. Antiviral having an antiviral property that is acceptable by all of you. I'm not talking doctor. I'm talking nursing perspective. Your pharmacological knowledge, you are happy that antiviral for the virus, favipiravir and remdesivir, you have no question or no query on that. But coming to antibiotics, there are certain antibiotics having antiviral property. How? Because these antibiotics not given for the antiviral property, I mean antibiotic property. They are being given for immunomodulation property. Azithromycin 5 days is an immunomodulating property. So it has been seen that the mortality and morbidity of COVID will be minimized, will be lessened That's the reason it is being used. Similarly, doxycycline for 5 days, 100 mg BD, even though it is antibiotic, but it is given for that purpose, not for the antibiotic. Your question is very valid of the person who has asked, that is valid, that this is not given for the antibiotic purpose. It is being given for the immunomodulation purpose or anti-inflammatory purpose. So that I want to clarify. Now, question to come, whatever studies has been done as of now, they are 12 years and above. So if I say prophylaxis of ivermectin, now prophylaxis of doxycycline is not there. Prophylaxis of azithromycin is not there. So once you are mild symptomatic or asymptomatic in a comorbid condition, you can go with azithromycin 500 OD for 5 days or doxycycline that can be given. But along with in UP government, and once upon a time the ICMR also told that doxycycline for 5 days plus ivermectin 12 mg day 1, day 2, day 3. All are given for the immunomodulation property. It has been seen that the during course of this, or if you give this, the progress from mild to moderate to severe is minimized. So they are having a immunomodulation property. But question is that can it be given to children? If I tell less than 12 years, no data is available, no trial is available. But we have not used this molecule below 12 years. And again, favipiravir, all are above 12 years. Some book says they are above 18 years. So this disease, COVID, is a disease of adult. It is not a disease of kids. So even if we are getting the mild symptomatic, we will just take paracetamol, some antihistamine, some cough syrup. That is enough. That is enough. And we love to give zinc because you might have known that zinc is recommended as a immunomodulator property for at least 2 weeks, 3 weeks. So that can be given. B complex can be given. The proper diet has to be given. So now children, there is no data. So I will not say it is recommended in children. But if you are going for the ivermectin prophylaxis, suppose you are a faculty in nursing college, I am a doctor, and you want to give this to me, or I want to give to you as a prophylaxis. Ivermectin, day 1, day 8, day 30, then monthly till the COVID goes. This is the prophylactic. But solo ivermectin. But in case of treatment, ivermectin day 1, day 2, day 3, along with doxycycline 5 days. This is the difference. And this has to be given only. This has to be given only in cases where it is mild or asymptomatic with comorbid. What are the comorbid? Diabetes, heart disease, atherosclerosis, obesity, all this hypertension, all these comorbids has to be there. So again, to summarize, first, not indicated or not recommended in children. They are recommended above 12 years. Ivermectin 0, 8, then 30. These 3 doses, 12 milligram. Then every month till COVID goes. The COVID will go by 2022. So till that you can continue monthly once this ivermectin as your prophylaxis. But coming to treatment day 1, day 2, day 3 with doxycycline 5 days. This is for the treatment. And we are using this antibiotic not for the antibiotic property, but for the immunomodulation property. Yes.
Thank you very much, sir. So I guess there is no question in the chat box. So end up with the questions. So thank you very much, sir, for joining us today. The session was really very much helpful to us. So now I request Mistress Ramada Mohanty to propose a vote of thanks.
Thank you, Dinabandhu. Good afternoon, everyone here. It is an honor for me to have the opportunity.
You are not visible.
Audio on mute.
Thank you, Dinabandhu. Good afternoon, everyone over here. It is an honor for me to have the opportunity to give a vote of thanks on this special day. I, Navanda Mohanty, on behalf of Pediatric Department, Some Nursing College, extend a hearty vote of thanks to all delegates of the webinar for their presence and contribution to make this webinar exemplary. I extend my special thanks to our Honorable Chief Guest, Dr. Prashant Kumar Sawant, Secretary, Odisha State, IAB, to take out valuable time from his busy schedule to grace the event. Thank you, sir, for inspiring and encouraging us with your valuable words on this special day. I also wish to express our gratitude to Dr. Professor Prabhati Tripathi Madam for providing support to make the webinar successful. Also, I would like to extend a special thanks to Mrs. Achla, Office Nursing Superintendent, Kalapati Saran Children's Hospital, New Delhi. Thank you, ma'am, for such a wonderful session. I must mention our profound sense of appreciation to Dr. Sunil Agrawal, Associate Professor, MKCG Barampur. We really thankful to you, sir, for giving excellent coverage to newborn care during COVID era. Thank you, sir. I also wish to give thank you, Mrs. Ruby Pradhan, Madam, Assistant Professor, HOD, Department of Pediatrics, Some Nursing College, for your minute-to-minute support and guidance for organizing this international webinar. Lastly, our sincere gratitude to all the participants for attending this event. Thank you so much. So now we are in the end of today's session. Day 2 session will start at 3 p.m. tomorrow. Thank you all. Have a great day.
Thank you. So thank you ଆପଣ join କରିକି ସମସ୍ତଙ୍କୁ ଏତେ enthusiast ତ ଆମେ ଏତେ ଜାଣିନଥିଲୁ ତ sir kindly next time ଯଦି ଦରକାର ହୁଏ sir ଆପଣଙ୍କୁ contact କରିବୁ ତ ଆପଣଙ୍କ session fast ରଖିବୁ so that you can take a lot of time. Thank you very much sir. So everyone is appreciating regarding your session.
Thank you, because always I am being called by the doctor platform. Because